As a psychotherapist, if an individual came to my office with a concern, there would be many options of treatment at my disposal. I think that the best approach would be Adler's idea of individual psychology. Alfred Adler was an Austrian medical doctor, psychotherapist, and the founder of individual psychology. Adler developed individual psychology, which emphasizes the importance of social factors and feelings of inferiority in shaping personality. He believed that psychology should focus on consciousness as a center of personality. Adler believed that individuals strive for superiority and success, and that social connections and community play a critical role in psychological health. His approach focuses on understanding the individual's lifestyle and the unique ways they cope with challenges. One specific type of therapy that I would introduce to my patient would be Adlerian pattern focus therapy. This is an evidence-based approach rooted in individual psychology, which aims to replace maladaptive behavioral and cognitive patterns with healthier ones. This type of therapy is rooted in 4 premises: unknowing development of maladaptive patterns, pattern change as crucial, holistic understanding, and a focus on strengths and social interest. The first premise covers the idea that individuals unknowingly develop self-perpetuating negative patterns in how they function and relate to others. These patterns are the root of their problems. The second premise emphasizes pattern change. Shifting from maladaptive to adaptive patterns is essential for effective treatment. The third premise is important for the psychotherapist. The therapy should consider the context of the individual's entire life to understand the development and maintenance of these patterns. This includes family, social, and cultural factors. Finally, the fourth premise proposes the unproductive thoughts and behaviors should be replaced with more productive ones to facilitate positive pattern change. Adlerian pattern-focused therapy will help my patient by addressing and changing behavior and thinking patterns that contribute to their difficulties. This therapy will foster self-awareness because it will encourage patients to understand how their past experiences and beliefs shape their current actions. We can then collaborate to set realistic goals to develop new and healthier coping mechanisms. This will help the patient feel a sense of control and competence, which will lead to improved mental well-being and a more fulfilling life. Fate versus free will is relative to individual psychology. Fate would imply a predetermined course of events, while free will emphasizes the capacity for individuals to make conscious choices and direct their own lives. In individual psychology, the concepts of fate and free will are intertwined. Adler believed that individuals are influenced by their past experiences and social contexts, which can be seen as fate. However, he also believed individuals possessed the ability to make choices and change their lives, which represents free will. Although our environment and upbringing shape us, we still have the power to change our behaviors and take responsibility for our own lives and decisions.